We're talking chronic fatigue syndrome for VA claim purposes, a continuation of a previous video where I talked about CFS and the rating criteria, which will be linked in description. Now, here I want to talk about CFS itself. Specifically, how is it diagnosed? So we'll get right to it. But if you find this helpful, save it for future references. It may help for a conversation with your healthcare provider. Now, we're at WebMD because, of course, that's where we're going to go for most things. But when we start looking at CFS, again, you see different naming conventions they use. Some things they look at for core symptoms: reduce ability to do the usual activities for at least 6 months or more because of fatigue, having worsening symptoms, difficulty thinking, problems sleeping, sore throat, headaches, feeling dizzy, severe tiredness after physical or mental activities, troubles falling asleep. Along with these three symptoms, one of these diagnoses of chronic fatigue syndromes is required. Things like problems with thinking or memory, or worsening of symptoms while standing, sitting upright. You may feel lightheaded, dizzy, weak, or you may have blurred vision or see spots, right? So, a few things to consider there. Now, going over to the CDC, because I think, again, I wanted to be able to hit it from different angles, they break down chronic fatigue syndrome with a few things extra. A serious long term illness that affects the main body systems. People with CFS are often not able to do their usual activities. Again, you have to be able to start describing this, not only for diagnosis, but for rating purposes. You'll see why. Looking at the CFS may confine them to their beds. People with CFS, for example, have severe fatigue, sleep problems. They get worse after people with this illness try to do as much as they want or need to. The symptoms is called post-exertion malaise, PEM. Other symptoms can include problems with thinking and concentration and pain, right? So we have that there. When it comes to how they diagnose the CDC side of the house, they look at the following. Doctors may refer a patient to a specialist like a neurologist or rheumatologist. I saw rheumatologists. I spoke about that in my previous linked video. Or a sleep specialist. Because again, you're looking at fatigue. So is it a neurological thing? Is it a rheumatologist? Is it sleep? That's why you see these three different providers are the ones that you'll see come up a lot. To check whether conditions can be cause similar symptoms. This specialist may find other conditions that could be treated. Patients can have other conditions and still have chronic fatigue. For veterans, specifically fibromyalgia. We'll touch on that too. So, understanding how these things are looked at is a key as far as a diagnosis is concerned. On the VA side of the house, they do recognize serious long-term illness marked by profound tiredness, unrefreshing sleep, cognitive troubles, etc., etc., etc. You see it there. However, do see that they look at instances like combat deployment being one of the things that is a factor, right? Syndrome is common among service members and veterans who are deployed to combat. Combat deployments have a higher probability of developing CFS. This happens a lot with Gulf War veterans because it's a presumptive. Now, symptoms like we talked about: fatigue, unrefreshed sleep, post exertion malaise, sore throat, headaches, tender lymph nodes, and so forth. So, all these things are going to be examined. Now, there are studies out there. PubMed, for example, looks at the post traumatic stress disorder and chronic fatigue syndrome like illnesses for Gulf War veterans in a population survey of 30,000 veterans, seeing what is the big picture there. And to highlight it, I kind of show here that while deployment related stress could account for the high risk of both PTSD and CFS, additional factors unique to the Gulf environment may contribute also to the risk of chronic fatigue syndrome among Gulf War veterans. So, location is also a factor when it comes to this. Jumping ahead, looking at the VA side of the house, same thing again as far as the presumptive side. So, if we're looking at veterans, for example, who have been in these areas, if you develop this anytime after service, that's a big one. So, Gulf War veterans, as you see here, boom, this highlighted, conditions diagnosed during active duty or anytime after service, you can still file for this. Moving ahead, one of the biggest thing here is the differences between fibromyalgia and chronic fatigue syndrome. So the biggest thing to look at here is bottom line. Fibromyalgia and chronic fatigue syndromes are very similar conditions, both featuring body aches and persistent fatigue. In fibromyalgia, however, widespread body pain and tenderness are the dominant symptoms. Whereas in chronic fatigue syndrome, fatigue is a common dominant symptom. So, something to focus on there. Another study that talks about basically breaking down the differences between fibromyalgia and chronic fatigue syndrome, and it breaks down the differences from a medical perspective, and them trying to argue that hey, you may have both, but they also are very different in nature. And as I touched in the previous video, going into the rating criteria, so if we're talking about CFS from a rating perspective, right? You have the diagnosis, you meet the requirements, you're able to make an argument. It either could be secondary, something else. However, you're staging the argument, now we start looking at how it's being rated: 10, 20, 40, 60, 100. It's a high value claim. So right at the 100, you have debilitating fatigue. Again, key words, you see them again. Cognitive impairments. Again, I showed that as part of the additional diagnosis and symptoms needed, or a combination of symptoms and signs, which are nearly constant, so severe that restrict routine daily activities almost completely, which may occasionally preclude self care. Again, you're in bed all day, you're not doing something, et cetera, et cetera, et cetera. You can break that down, right? At the 60 range, they're nearly constant and restrict routine activities to less than 50% of pre illness levels, which wax and wane, resulting in periods of incapacitation for at least 6 weeks, and then goes lower and lower from there. So, moral story here, as you see, the whole point is to make sure that when we're talking CFS, you have a diagnosis, you understand what your symptoms are, see a specialist, rheumatologist, see your sleep study professionals or neurologists, get diagnosed, get seen, take inventory of the fatigue levels, not just I'm tired, no matter how much you sleep. Again, we broke these things down. There's so much to cover, but the point at hand here is know your symptoms because if you're able to speak to those things and you're able to get care and show that proof and you meet the requirements, then you can make an argument to the VA for how you're affected. If you have fibromyalgia, okay, check, that's 40%. But on the CFS side, that can go to 100. So understand what you're able to file for and how that's rated. Again, a high value claim, a deeper dive than before, but hopefully this helps. If you have questions, I'll see you in the comments section. Make sure you save this. I told you in the beginning because it's a lot of information to digest.